Namaskar, my name is Dr. Nitesh Rohatgi and I am a Senior Director, Medical Oncology at the Fortis Cancer Institute in Gurugram. As a medical oncologist, one of the commonest problems I face is a lot of patients on chemotherapy talk about specific diets and also about taking alternative medicines from all over the place. Now that can be a homeopathic, it can be Ayurvedic, it can be a Chinese mushroom, and the list is long, from Shimoga to Simpuru. But question that really is there benefit in doing that? Is there lack of harm? Or is there in fact harm in doing that? क्या फायदा नहीं है, फायदा है, या एक्चुअली नुकसान हो सकता है? मेरे हिसाब से कैंसर के इलाज को डिवाइड करना चाहिए. सर्जिकल पीरियड, रेडिएशन पीरियड, कीमोथेरेपी एंड देन अ फॉलो अप पीरियड. अब इसमें जो आपका रेडिएशन एंड कीमोथेरेपी पीरियड है, माय हम्बल रिक्वेस्ट इज प्लीज अंडरस्टैंड you are taking chemicals and radiation at that time, and that does have a chance of interaction with some basic herbs. बड़ा common है, wheat grass ले लो, wheat grass, papaya juice makes platelets high. How does it do that? क्या पपाया जूस और व्हीट ग्रास बॉडी में जाके बोलते हैं ये कैंसर का सेल है, इसको मत छेड़ो, ये प्लेटलेट है, इसको बढ़ा दो? क्या वो कैंसर से सेल को भी बढ़ा सकते हैं? शुरू में तो दिखेगा नहीं. And we have very little research or data to say that people who did any of the alternative medicine actually lived longer or better, or actually lived less. And when you don't know, is it logical to take a risk with your life just because 10 people on Google and WhatsApp believe that's the right thing? They're not undergoing treatment. Anything that makes your chemotherapy toxicity completely zero, is it doing that by making the chemotherapy ineffective? We don't know that. Don't take that risk with your life. These therapies, these chemotherapies are proven upon millions of people. They can't be crazy. The reason why chemotherapy is increasing in the world is not only because cancer is increasing, but because curability of cancer has gone from low 20s to high 80s. Chemotherapy is an important role in that. Radiation is an important role in that. You cannot undermine that and try to decrease its effectiveness by a thought कि शायद ये लेने से मैं ठीक हो जाऊंगा. हाल में कुछ लोगों ने, a patient of mine in fact took a very important bark of a tree to decrease the side effect and improve curability of cancer. Surprisingly, a drug which does not cause liver side effect, a chemo which does not cause liver side effect, cause liver side effects. I was surprised, so I went and asked the patient and he said, जी हम थोड़ा सा ये खा रहे हैं. It took me 10 minutes of Google search to take out the compound in that bark of the tree and my chemotherapy and show that that interaction can cause in fact liver failure. I was glad he told me because we could figure it out. But what if we hadn't? Giloy is an example of that. Arjuna bark tree is an example of that. I am just saying it is illogical कि जब आपके पास evidence नहीं है, do not, my request is do not presume everything you're reading is right, especially when you're undergoing chemotherapy and radiation. So when asked कि क्या हम कुछ एक्स्ट्रा खा सकते हैं अदर देन द डेली डाइट जो सदियों से खाते आ रहे हैं, my answer is going to be no, and my request to you is no too. Please take this seriously. Thank you.